Thank you for joining us today, everyone. It's 3:30 on Tuesday, April 6th. We are going to start today's QC COVID-19 press briefing. With us today, we have our public health departments. We have Nita Ludwig, Administrator of the Rock Island County Health Department, as well as Amy Thoreson, Interim Director for Scott County Health Department. And we're joined today by partners with Genesis Health System. We have Beau, Dexter, Director of Clinical Operations for Genesis. And then with UnityPoint Trinity, we have Matt Behrens, who's the Regional Vice President of UnityPoint Clinics. Tom Bowman with Community Healthcare is also going to join us if he is able to. He was pulled away just a little bit earlier, so he may join us if we're able. We're going to start today with our statistics for COVID cases as well as some vaccinations. We'll start first with Nita. Thank you.
Hello. In Rock Island County today, we do have 13 new cases of COVID-19, which brings our total to 13,639 cases. 25 people are currently hospitalized in Rock Island County, and unfortunately, we have one death to report today, a man in his 70s who had been hospitalized, and our deepest condolences go out to the friends and family of this person. Our deaths now in Rock Island County total 309.
In Scott County, there have been 19,692 positive tests. Our 7-day positivity has risen to 12.7%. We were below 5 for several weeks. We've had 233 deaths, which is an increase in 7 since we talked last week. And as Nita shared, we too also extend our deepest sympathies to the family and friends of these individuals. In Scott County, there have been 92,900 vaccines given, which is good news, with 32,800 residents fully vaccinated.
Then we'll hear from Nita with Rock Island County on some information regarding vaccinations. Can you unmute, Nita? Thank you.
So sorry about that. We do have in Rock Island County, we have almost 18% of our population totally vaccinated for COVID-19, and we have now vaccinated more than 67,000 residents in Rock Island County. The Camden Center, supported by the Illinois National Guard, continues to operate Monday through Saturday, 8 a.m. to 4 p.m. with 800 to 900 appointments available each day, and they will remain in operation through the first week of June.
Thank you. Amy, we'll go ahead and hear your information for Scott County vaccinations.
Yesterday, April 5th, was a monumental day when every individual over the age of 16 became eligible for COVID-19 vaccine in Iowa. It is truly amazing that just a few weeks after the 1-year anniversary of our first case of COVID-19, we have access to 3 highly effective and safe vaccines to protect against the severe illness and death that can be caused by the coronavirus. Many individuals are worried about which vaccine they should receive. The best vaccine is the one you get access to first. At this time, the Pfizer vaccine is the only vaccine available to youth ages 16 and 17. Pfizer has started trials for their COVID-19 vaccine on the 12 to 15-year-old age population, and the results look promising. However, Pfizer is not yet authorized for this age group. We have overcome many hurdles to vaccine rollout, including strict prioritization requirements, limited vaccine supply, and the need to figure out how to distribute a vaccine that requires extreme storage requirements while also ensuring strict social distancing measures. This type of rapid response has never occurred in public health before. Our next hurdle is making sure that enough individuals are vaccinated to truly ensure the virus is no longer able to spread due to immunity of its possible hosts and to do this while we are seeing cases rise to uncomfortable levels again. The time to act is now. We each have a choice to be vaccinated for ourselves, our families, and our community. Luckily, we aren't at loss for options on where to get vaccinated, and these options continue to increase. Many will choose to look to their healthcare provider for vaccine. We have invited 3 of our large system providers to join us today to describe their vaccination registration process. Thank you to Beau and Matt, and hopefully Tom as well, for joining us today.
Thank you, Amy. We are going to hear first today from Tom Bowman, the CEO of Community Healthcare. If you can put your camera on, Tom, we'll let you get started.
Yeah, so we have continued to do a number of different things to get vaccine out, whether that's going mobile to multiple locations and congregate housing settings, homeless populations, and others. We've set up shop at the YMCA or the old Y in downtown, where we are running regular clinics. We feel like we have the capacity to do 800 to 1,000 on the Iowa side per week. And so right now, one of the biggest challenges that we're facing is filling up slots. And so one of the things that I wanted to highlight today is that we continue to see people no-show for appointments, or they have gotten it somewhere else and failed to cancel for us. And we do not want to waste any vaccine. And once it's opened, it is not able to be, it has to go in arms. And so we are doing Moderna for the most part. We have gotten limited amounts of Johnson & Johnson. We've heard from patients that they're waiting for Johnson & Johnson. So I would reiterate Amy's comment to just take the vaccine that is available as soon as it is available. But we will have openings. Patients can go to our website at www.chcqca.org, or they can go to our Facebook page, find us on there, and they can screen and be signed up. We anticipate it'll be a couple of days before they would be able to get the shot, sometimes within the same day. So we do have vaccine available every week, and we are just asking community members and our patients to please sign up and get in as soon as you can.
Thanks so much, Tom. Next, we'll hear from Beau Dexter with Genesis Health System on how vaccine rollout is happening there. Thanks, Beau.
All right, thank you, and thanks everybody. I would just want to echo the same comments Amy shared. We've been saying for several months, be patient and get the vaccine when it's your turn. And with the expansion of vaccines in Iowa to age 16 and older, your turn has come. The more people we can vaccinate, the quicker we can start to return to where we want to be. I want to share that the people being vaccinated now in the clinic are relieved. They're ecstatic. Oftentimes there's tears of joy because it means they're one step closer to seeing their family and friends again. So the benefit of vaccination is it's not just a physical health, but also we're seeing it as mental wellness. It's been difficult and disruptive for all of us. Our vaccination efforts have greatly increased this past 2 weeks as we've opened our former Dick's Sporting Goods on Elmore. This retail-sized clinic has sped up our process for thousands. The clinic's giving vaccine Tuesday through Friday, and this weekend we will actually start with Saturday hours as well. We are able to vaccinate up to 1,300 patients a day, and we've been very efficient. It's a very patient-friendly clinic with capacity, as I mentioned, of 1,300. We do currently still this week have 1,700 appointments available this Thursday and Saturday. So we really want to encourage everyone to go out, sign up. Our vaccinations can be scheduled at genesishealth.com by going to the My Genesis patient portal. There are step-by-step instructions available on how to open an account or use an existing account to schedule your vaccination. Even if your primary care provider is not Genesis, you don't go to a Genesis physician each year, you can still sign up through the portal if you've ever utilized a Genesis service, such as a lab, an ER visit, convenient care. If you are 16 or 17, you do not have access to the portal, so we encourage you to contact your primary care provider, and they're going to assist with getting you scheduled. We are seeing an increase in our community, as many have mentioned. Our hospitalizations are up. Our symptomatic rate is increasing. So our message is, if you're 16 and older, it's your turn to be vaccinated. We have safe, effective vaccine available. The process is quick and it's efficient. And we want you to get vaccinated so we can safely return to being able to socialize, spending time with grandkids, friends, parents. And we are in this together. We want to continue to promote wearing masks, practicing social distancing, and all washing our hands. Thank you.
Thank you, Beau. Appreciate it. Next, we'll hear from UnityPoint Trinity, and that will be Matt Behrens. Thanks for joining us, Matt.
Thanks, everyone. I want to echo Beau and Tom's comments. The vaccine works and is working. Our numbers are climbing in terms of people that are being hospitalized right now. We were at a low about 3 or 4 weeks ago, around 15 patients, and right now we're over 32 patients in our UnityPoint Health facilities. But those patients that have been vaccinated are not the patients that are coming down with the virus. So it's definitely working. So we too want to put as many vaccines in arms as quickly as possible. And the way to do that with us is twofold. One way is we are pushing out texts to anyone that is eligible for the vaccine. And you can go in and click on the link and schedule. Or you can just call your primary care provider's office and they will go ahead and get you set up for the vaccine. If we don't have enough immediate appointments, we'll put you on a wait list. Although I will tell you that we are not filling all of our spots as quickly as we were before. So there is availability for patients. In terms of, I guess that's the Iowa side of the river, the Scott County side of the river. Illinois side, of course, we're working with Rock Island and the health department and utilizing the National Guard to vaccinate our patients in Illinois.
Thank you very much, Matt. Appreciate all that information. And we wanted the community to understand, access and availability to these vaccines through our health systems, along with pharmacies and some others there. And now that it's open to so many more in Iowa, we're really hoping that we'll see those numbers increase there. I have received a couple of questions ahead of time that I will go ahead and go through right now. First question we received, and I know you both have addressed this for Genesis and UnityPoint, was about the surge or the increases in COVID hospitalizations. But for both the hospitals and the health departments, which we can start first with Nita and Amy, do we know if the variants are infecting people or making them ill? And is that even something that can be determined at this point?
Well, we know that COVID and coronavirus is what's making people ill. And so variants are still part of that. We're hearing, as you all are, that they're much more infectious. We don't have specific numbers because not every individual that has COVID is tested for the variant. It's a very lengthy process. The State Hygienic Laboratory in Iowa is increasing their capabilities, but right now there's specific criteria that are, when they're doing the testing, a physician can request it if somebody's traveled internationally, if somebody's a contact to someone who's traveled internationally, if someone's had COVID before and this is a reinfection. So there's some specific criteria, but we do know that those variants, particularly the UK variant, is circulating and it is making people ill.
I believe we also have Dr. Katz on the call. Dr. Katz, do you have anything to add about the variants there, if you're able to unmute?
Yeah, I communicated with the state lab today. Nationally, it's over 20%. We don't have good numbers because we don't have a good denominator in Iowa, but we'll next week or the week after. I'm sure that we're in that range of 20 or 25% variants. Almost all of those are the UK variant, 50% or so more infectious. And probably 40 to 60% more lethal. So they're here. They're not the majority yet, but they will be soon.
Dr. Katz, do you want to give your plug for non-pharmaceutical interventions again?
Yeah.
Related to the variants.
Yeah, the variants don't know the difference. A mask doesn't know the difference between a variant and a wild type virus. And the variants don't travel further when people talk, sneeze, sing, scream, etc. So there's so masks and physical distancing will be just as effective for variants as for the progenitor or wild type virus. And this is one of the 12 reasons we continue to tell people it's critical to maintain non-pharmaceutical interventions. Mask, physically and socially distance, wash your hands, etc.
Thank you. Janet, the question on contact tracing I'll send to you. Is it showing, what are you learning from contact tracing? Is it showing where people are getting infected right now as we're seeing some of the jumps in this? And, you know, this could take on added importance as we learn about the demographics becoming younger individuals who are being infected right now.
Did you mean that for me, Brooke?
Yes, did I? I'm sorry.
Yeah.
I thought I said your name, but it might not have come out that way.
You
Yes,
said
Nita, thank
Janet,
you.
but I don't think Janet's on this one. So
You're right. I'm sorry.
No, that's okay. So what I was going to add only is that the Illinois Department of Public Health labs are also beefing up their ability to test for these variants. And we do have these variants in our community as well. And again, they are making people ill and infecting others. And we are seeing that in younger populations. And when we do have these variants identified through, it is random testing that the state lab is doing. But when we do get some in our community, our contact tracers do follow up on those and just like they do every other positive case. So they are still calling and reaching out and asking the questions of what kind of events have people been going to and where they might have become infected and who their close contacts are. And of course, educating on how to safely isolate. And of course, the same messaging as Dr. Katz was saying, which is continue to wear your mask, social distance, wash your hands, and get vaccinated when you can.
The last question that I see here is in the chat, and it's for Amy and Nita. There's a fairly large disparity between the positivity rates reported by the hospitals and the case rates reported by the counties, excuse me. Can you explain that for our readers?
Well, what we're reporting is the overall positivity rate for the county. So you have to remember that that's taking into account every test that's being done in Scott County, whether that's routine screening that perhaps an employer requires of their staff or at a long-term care facility, or somebody going through Test Iowa, or someone going to their doctor or an urgent care. And so there are people that are going to be tested fully expecting that they are negative. They're going to travel. They've returned from travel, something like that. The health systems are reporting numbers on the people that are coming to them for testing. Likely that testing is because they're not feeling well or they were around somebody who was positive. Because I don't know about you, but I don't want to go to the doctor if I don't have to. And so I wouldn't just call up my provider to schedule an appointment for a COVID test for no reason. So I believe that's the disparity, at least for Scott County.
And I would say the same is very true. What I'd like to point out is that according to the Illinois Department of Public Health, Rock Island County's positivity rate for the date of April 3rd, which is just a couple days ago, is 4.8, which is still well below the warning level. However, just a few weeks ago on March 24th, our rate was 3.3, and it has gradually continued to go up. So we certainly do not want to see that continue to go up. We've also seen, younger people becoming infected, kids under 14. And as the question, I believe, was about contact tracing, through the contact tracing, we have basically determined that most of that is just family gatherings. So people are becoming a little more lax, the weather's getting nicer, they're getting together. And that is why we continue to stress the messages of wearing masks and social distancing. We're not over this yet. The variants are out there. COVID is still out there. And we want people to take the precautions and certainly to get vaccinated at their first opportunity. And again, on the Illinois side, it is also open for those age 16 and over now. But the 16 and 17-year-olds can only get the Pfizer vaccine. So you really need to make sure that you're scheduling anyone those ages for Pfizer and not Moderna or the Johnson & Johnson product at this time.
Thank you. Looks like we'll be ready to conclude for today with no additional questions from our media partners. Thank you for, again, Nita and Amy for your weekly updates, and then for joining us today to Tom, Bowman, Beau, Dexter, and Matt Behrens, Dr. Katz as well for chiming in as asked. So we're grateful for all of that information. We will be sending this out in our press release, and we will be posting the recording on our website as well as on our social media pages, so you can check that there. And we look forward again to talking with you all next week. We will send any information if we need to in the interim. But thank you all for being here, and we will talk with you all soon.